Thank you for joining me today in the Group Health Cooperative of Eau Claire and CareSource, previously known as Common Ground Healthcare Cooperative, 2026 State of Wisconsin Group Health Insurance Program Open Enrollment Session. I am Kira Simon, Director of Sales, presenting to you from Group Health Cooperative of Eau Claire. Group Health Cooperative of Eau Claire operates with a purpose, and that purpose is to optimize the health of our members through the cooperative's pooling of health-related resources. So what makes a cooperative different? We exist to serve and meet the needs of our members. We believe in genuine relationships, authentic interactions, and long-term partnerships. That's why every time you call, you'll speak to a real person right away. As a cooperative, our unique model focuses on our members and not outside shareholders. This allows our members to receive high quality care and excellent services at the lowest possible cost while serving our members' needs and keeping community resources in the community. The cooperative is governed by our members. As a member governed health plan, our members directly influence how the cooperative operates. Our members have greater access and support. At the cooperative, we are dedicated to helping our members better manage their overall health and well-being and ensuring they have quality care available, allowing them to focus on what matters most. In 2026, Group Health Cooperative of Eau Claire has three health plan options for ETF members: the Group Health Cooperative of Eau Claire Greater Wisconsin Network, the Group Health Cooperative of Eau Claire River Region Network, and a health plan offering through the partnership of Group Health Cooperative of Eau Claire and CareSource, previously known as Common Ground Healthcare Cooperative. There are no major network changes for 2026, and yes, each member will receive a new ID card. For the Group Health Cooperative of Eau Claire and CareSource network covering these 16 counties, this includes the major health systems of Advocate Aurora Health, Theta Care, and Baycare clinics. To find a provider in your health plan network, please visit our group health website and use the Find a Doctor tool. Select your plan, enter your search criteria. If you have additional questions, please call us and we can help. The covered benefits in your 2026 health plan include preventative services, specialists, primary care, and telehealth, all covered under the cooperative's benefit structure. Cost share may apply, and some services may require prior authorization. Additional covered benefits can be found by visiting our group health website. Please consider benefit restrictions, including out-of-network services. The provider network you choose has a variety and number of providers to meet your healthcare needs. If you receive services from a provider outside of your network, it will not be covered unless it's for urgent care or an emergency room. Some services may require prior approval or may not be covered based on medical necessity. Benefit exclusions and limitations can be found on our group health website or by calling our member services. We offer many programs to help our members, like population health management programs. The cooperative offers comprehensive population health management programs for members, which include complex case management and disease management. A list of programs and how to enroll can be found on the cooperative's website. Self-management tools allows members to play a central role in managing their health and gives members resources to make behavior changes and improve their well-being. Health and Wellness Video Library. The Cooperative offers an expansive library of informational videos pertaining to a wide variety of health and wellness questions and concerns. An additional program to help members is the Utilization Management Program. The Cooperative's Utilization Management Team works closely with members' physicians and hospital staff to ensure that members receive necessary care before, during, and after their hospital stay. The dedicated team also assists and coordinates with members to ensure they get the right care at the right place and time. The Utilization Management Program has a sequence of procedures, starting with a pre-service review. That is, a request for coverage of medical care or services which the provider must have approved within 14 calendar days prior to rendering services. Next, an urgent concurrent review, a request for coverage of medical care or services made while the member is in the process of receiving care, must meet criteria and be completed within 24 hours of the request, followed by a post-service review, a request for coverage of medical care or services that have already been received, must be completed within 14 calendar days. And finally, filing an appeal. A member may appeal any adverse benefit determination. The Pharmaceutical Management Program. Procedures for drugs you receive through the pharmacy. Pharmacy benefits are managed by a pharmacy benefit manager, a PBM, called Navitus. For processes related to these drugs, you will need to follow up with Navitus customer care. For procedures for drugs that are part of the medical benefit, processes on how we manage drugs covered under the medical benefit, which are drugs that are not covered through the pharmacy, can be found on our website. The processes outlined on the website include covered drugs, copayment information, drugs that require prior authorization, limits on refills, doses, or prescriptions, the use of generic substitution, therapeutic interchange, or step therapy protocols, and how formulary updates are communicated, how often, and if the organization has scheduled formulary updates. To learn more about your pharmacy benefits or for questions, please visit the Benefit Plan Navitus ETF website. Advanced care planning is very important to consider. What is advanced care planning? It is the process of communication and planning for future care needs. Ongoing conversation that is not a single event or a single conversation. So, why should you care about advanced care planning? The care you receive can better reflect your wishes. Your loved ones won't have to guess if they've made the right choice. Your healthcare team would be aware of your treatment preferences. It can reduce unwanted care, treatment, and hospitalizations. Your agent has legally recognized status as a decision maker. There are many resources available to help you with getting more information, as well as finding assistance in completing an advanced care plan. Here are a few websites you can visit: the ETF Advanced Care Planning website, the Group Health website, and DHS Wisconsin Advanced Directives website. Our privacy responsibilities include protecting the privacy of any protected health information created or received about you, notifying you if there is a breach of your protected health information, using and sharing protected health information only as outlined in our Notice of Privacy Practices and by state and federal laws. To view the full Notice of Privacy Practices, visit our Group Health website. Now I'd like to show you how to navigate our Group Health website. When arriving to the Group cooperative-health.com website. You'll arrive at our homepage. Please click on the Members tab at the top. You will see a member login for our portal. If you are a current member or are going to become a member, I encourage you to register for the portal. When you log in, you will be able to access your plan benefits, claims, deductibles, EOBs, plan policy documents, privacy practices, and your member ID card. By scrolling down through the member resource page, you will see the 3 ETF plans that are offered to our ETF employees. Click on the plan you are most interested in or are a part of. This will take you to your 2026 open enrollment information. Here you will have another opportunity to log into your member portal. You will also have access to 2026 plan and enrollment information, including your summary of benefits and coverages for each of the plans, additional resources like an online provider search tool, health plan guidebooks, and provider directories. You also have access to the 2026 service area maps, a link to our telehealth program with Teledoc, and frequently asked questions. This concludes the presentation for Group Health Cooperative of Eau Claire's Health Insurance Program for 2026. Thank you for joining me today.